Welcome to Easy Treatment Healthcare Private Limited, your bridge to global healthcare. At Easy Treatment, our mission is to be your preferred healthcare partner, providing personalized and comprehensive medical assistance to patients worldwide. Our vision is to be a global leader in medical tourism, known for our commitment to quality, compassion, and excellence in patient care. At Easy Treatment, we cater to all patients, ensuring a seamless healthcare journey regardless of your location or background. Start with a simple inquiry. Contact. Visit our website for an initial consultation, where we'll understand your medical needs, preferences, and budget. We conduct a thorough assessment of your condition, discuss available options, and assist in scheduling appointments with top-notch healthcare providers in Hyderabad. Our dedicated team will accompany you to hospital visits, ensuring smooth communication with healthcare professionals. We provide continuous support throughout your treatment, from follow-ups to medication assistance. Even after your treatment, we're with you every step of the way. From post-treatment care to coordination of follow-up appointments, we've got you covered. Our comprehensive services include medical tourism, free medical assistance, appointment scheduling, medication and investigation support, second opinion services, and budget-friendly hospital selection. Our exclusive services includes organ transplant, joint replacement, robotic surgeries, neurosurgeries, heart and cancer treatments. For our NRI patients with parents in India, we go the extra mile. We support in carrying them to the hospital and ensure their safe return home. We welcome your loved ones with open arms, offering arrival support, airport transfers, and initial orientation. Experience hassle-free healthcare with Easy Treatment Healthcare Private Limited. Your journey to wellness begins with us. Contact us today at
Good afternoon, all. This is Seema from Easy Treatment Healthcare Private Limited, and I'd like to warmly welcome you to today's webinar about understanding low back pain, part of Ask the Doctor series of webinars and events. At Easy Treatment Healthcare Private Limited, we are trusted partners in healthcare and leading medical tourism company, dedicated to simplifying your journey to better health. Our mission is to bridge the gap between patients and world-class medical expertise by offering a one-stop platform for personalized healthcare solutions, from connecting you with the right specialist to providing guidance on treatments. We ensure a seamless and compassionate experience. Our services are booking appointments with best doctors and specialists, guiding you through advanced treatments and minimally invasive procedures, offering friendly support to help you make the right health decisions, and providing a simple platform to explore services, ask questions, and book appointments. Assisting international patients with complete medical tourism solutions, including travel, accommodation, and hospital coordination. We are proud to be your healthcare partner, offering accessible and affordable solutions for everyone, whether you need advice, treatments, or just a better understanding of your options. We are here to assist every step of the way. We are excited to have you with us today as we uncover invaluable insights into low back pain and latest advancements in treatments. Our agenda: here is what we will cover in today's webinar. Introduction on low back pain, that is causes, symptoms, and when to seek medical help, treatment options, overseas of cutting-edge techniques, and minimally invasive procedures. Our question and answer session: ask answers to your questions from an expert. Special free screening. Our special offer is special free screening, 30% off on treatment costs. And about the speaker, we are honored to introduce Dr. K.S. Kiran, a highly experienced consultant neurosurgeon with over 15 years of expertise in the field of neurology. Dr. K.S. Kiran is currently associated with Yashoda Hospital, Secunderabad, and specializes in spine surgery, skull-base surgery, and minimally invasive procedures. Dr. Kiran has performed hundreds of successful surgeries, including complex vascular, pediatric, and skull-based procedures. He has trained internationally at Osaka University, Japan, and has participated in advanced workshops on spine surgery and endoscopic techniques in India. With a medical degree from Kakatiya Medical College and an MS in General Surgery from Osmania University, Dr. Kiran has also served as an assistant professor at Nizam's Institute of Medical Science. His dedication to patients' care and cutting-edge treatments make him a trusted expert in neurosurgery and spinal health. We are thrilled to have him lead this session. So, Dr. Kiran, please, you can continue.
Yeah, hi all. Hello. Yeah, I am Dr. K.S. Kiran, Senior Neurosurgeon from Yashoda Hospital, Secunderabad. So today our topic is lower backache. So why we have selected this lower backache? Because this lower backache is a common problem, not in old men or women's, or it is also problem in young generation, and it is also problem in our school children. So that's why we have selected this lower backache. So first, what is this lower backache? See, what we'll call generally, many patients will be complaining of whole backache. Whole backache means there will be a pain in your whole spine. But for our medical easiness and all those things, we have divided the backache into lower backache, mid backache, and cervical backache. So cervical backache is somewhat we'll call it as neck pain. And dorsal pain, which is the mid part of your spine, it is called as dorsal backache, and lower backache is your lumbar part. So for any human beings or for any this thing, we can divide our spine into three parts: neck part, mid part, and lower backache part. So now we are interested in lower backache. So first we will classify this lower backache according to age and according to symptoms. So first point, lower backache, if you'll divide it is acute and chronic backache. See, what is acute backache? Acute backache means sudden catch up of the pain is called as acute backache. And what is chronic backache? Chronic backache means since years or months, more than 6 months, or since years you are suffering with the pain, dragging type of pain in the lower backache. That is called as chronic and acute. So acute means, as it should be clear, acute means within 3 days sudden catch of the pain. Chronic means since months or years suffering from the lower backache. So this is called as acute backache and chronic backache. Next, depending upon the symptoms, many patients will be complaining of only lower backache, but some patients will be calling as sciatica. That means that your lower backache is radiating to your leg. It might be right or left. It is called as sciatica in our terms. So with radiation, without radiation. So this is another type of classification. First is acute and chronic, with radiation and without radiation. And next classification will come depending upon the age. So first we'll see the children's who are school going. You can see the children. So many children nowadays, they're suffering from neck pain and back pain. See, what is the cause? So first cause is your nutrition. So in olden age days, we are having healthy foods, daily eggs and nice without any adulteration and all those things. We will be having healthy foods. But nowadays, you can see almost even egg, meat, all are adulterated or contaminated. So because of this, proper nutrition. And next point, your sitting position at your school. So in many schools, I will be seeing your sitting position means your bench on table or bench on which you are sitting. That position, that model is not good. So because of also that one also, so children are suffering from back pain. And next you can come to next is overweights. Means your bag, school bag is overloaded with all books and all those things. That is also one of the cause for the backache in the children. And next is genetic abnormality. Means by birth there are some abnormalities by birth. Means spinal dystomelia or dysphagism disease, spine dysphagism we'll call it as in our medical term. So these are all in birth this thing. So in birth also, by birth also, children will be having some spine problems which are exaggerated as your age grows up. So this is the classification in your children's. So in children's, you can see depending upon your sitting position and depending upon your school bag load and depending upon your nutritional and all those things and depending upon your genetics, the lower backache is most common. Next point, now coming to the adults. So in adults means young age between 20 to 30, 35 years, you can see many software people or many employees or many soft collar job people, they are suffering from severe backache. So why this? See first point, this is so in young age, so many software people or anything software or any soft collar job people, first point is your addictions. Means because of stress and all those things, many people are addicted to this smoking, alcohol, masala foods, and all those things, which are the one of the cause for lower backache. You can say how you can relate smoking or alcohol to your backache. Because of smoking and all those things, there will be a osteoporosis in your bone, spinal bone or spinal canal, which will cause you the backache. And next is the masala junk items. Junk items means daily non-veg and almost masala foods, that will also cause your lipid profile to flare up and which will cause your lower backache and some homocysteine levels, and that is a medical term, we'll leave it. Okay, next point. So this is the one factor in the young adults or young working women or smoking, alcohol, and their lifestyle problems. Lifestyle means junk foods and sleeping at the late nights and all those things. That is the one of the cause. And next important point for young generation is your bikes. See, in olden days, bikes are very simple. Now they have designed in such a way that it looks more fashionable and all those things. Because of also means you will bend more and you will ride it. So that is also cause for your back pain. So one of your bike or this thing vehicle which you are using, so that is also one of the cause. And next, the important cause is ergonomics at your workplace. See, what is the ergonomics at your workplace? See, ergonomics means the procedure or there is a technique that you have to maintain while you are doing work at your office. For example, your sitting posture. So in sitting posture, your what we'll call it table or chair, it should be certain height so that your muscles should not be strained. So that the design of your chair and table should be in equal this thing. There are some measurements that you have to check in your this thing. So that is your work ergonomic place. So at ergonomics place, work ergonomic place, you should be, so for every young adults or for every person who's doing job at your, you should check Google or YouTube at ergonomics at workplace. In that they will show you how to sit, how to what will say how much time you have to sit and how much time you have to relax and how much in between what stretches you have to do, they will clearly. So that is the main cause at workplace. So in young adults, one cause is your lifestyle problem and second one is your ergonomics at workplace. So this is wrong. Next classification comes to your older age. In older age, because of wear and tears and all those things, almost your spinal canal, which is there, it is degenerative disorders. Because of your, in women who have crossed 50 years, we'll call as post-menopausal women. So in that age group, osteoporosis is most common. So in that osteoporosis, your spine has been weakened up. So by doing any work or sitting down or bending forward, you will get severe pain, which will leads to your degenerative of the spine. So that is the most common in old age women because of severe osteoporosis and all those. And in men also, because of age more than 60 years, and you will be seeing all backaches because of degenerative of the spine. So another is, and so this is the classification depending on the age. So you have seen in children, you have seen in adults, and you have seen in old age peoples. And another classification is trauma versus disease. This thing. Trauma means when you are having any accident. So because of whether it is a minor or major accident. In major accident, you can see there is a paraplegia, means your lower limbs will be numbed and your power will be reduced in the lower limbs. That is called as paraplegia. In paraplegia, you can see in high injuries, high mode of injuries. In low mode of injuries, instead of you are getting paraplegia, you will get continuous pain in the lower back because of the facet joints dislocation, or there will be a mild stretch over these facet joints, or the ligaments, interspinous ligaments will be there. Because of that, you will be having continuous backache. So this is the classification for trauma and diseased one. So this is very important. So all people should know about the disease of this one. So what is the disease? So generally you will see a bacterial infection in your spine. So because of bacterial infection, you will have severe pain in your lower back. So on movements, you will get pain. On movements, you will get lower back pain. And next point is, one is bacterial and another is tubercular, means TB. Tubercular infections are most common in the back spine. So you should be very cautious. So generally there are warning signs, means the flare-up signs, flag signs, or warning signs in your low back, means severe lower backache with you are unable to move your lower limbs, or there is a severe sciatica because of which you are not able to walk. This is the one warning sign or flag sign for you to consult immediate a doctor. And another is your bowel and bladder, means your urinary sensations and motion sensations. This is called as bowel bladder symptoms are there, means your symptoms, your sensation has been decreased. This is a warning sign or early flag sign to meet your consultant nearby neuro. And another is slowly progressive weakness of the lower limbs. This is also one of the flag sign. So one is bowel and bladder, and another is another difficulty in walking, and another is severe radiating pain. So this is the main, these are the flag signs, these are the warning signs, so that you have to consult your doctor. Next slide. So now I am discussing generally slides what we have prepared. So as previously I have told, what is acute pain? So acute pains means less than 6 weeks, and chronic pains means over 3 months, not 3 months. Some years also will classify as chronic pain, and referred pain. And I have told you the referred pain. It is called as sciatica. So see, remember, see, whenever you are having chronic back pain and suddenly it has radiated to your right limb or left limb, it is called as sciatica. So this is a means the muscle which has been spasm, gone into spasm. Now this spasm has changed into a sciatica, means pain radiating to right limb. That means there is a compression over the nerve. So this is the one of the flag sign that you have to see your neurologist. So symptoms of low backache. So as we have discussed earlier, see, generally if you will lift any weights or if you are going for any long distance, you will feel these primary symptoms like persistent pain, stiffening, and difficulty. So in any patients, we'll be seeing initial symptoms will be only dull aching type of pain, means that you will feel very dull type of aching type of pain at the back. So if you neglect this one, then it will go into stiffness, and it will be increasing. Your pain will be increasing while bending or lifting. So for any primary symptoms, starting symptom will be your dull ache pain. If you neglect this one, it will go into stiffness, and pain will be increasing on bending forwards or lifting. And next point, there will be a change in the character of the pain. You must listen and you stress this word what I am telling. There will be a change in the character of the pain. Means what? Means your lower backache has changed its character into by radiating to the limb. It is called as change in the character of pain. Means this is the flag sign for you, and you have to 100% consult your nearby neurologist. So this is called as additional symptoms like pain radiating to legs, muscle spasms, discomfort while sitting on, and severity level ranges from mild discomfort to the chronic one. So generally, I have told what are the causes of lower backache. So general causes are poor posture of prolonged sitting. So this is called as I have divided your lower backache the causes according to your age. Like I have previously discussed in children's, in adults, and in old age people. In children's, because of nutritional, and because of your school bag weightage, and because of your sitting posture at your and in young generation, I have told ergonomics at your this thing, lifestyle habits, and your vehicle bikes, what it has designed, what that is it is called as. Okay, right. Next, previously what I have discussed, it is there in the slide. And next, so I'm telling you, so if anyone, you people are having lower back, it is at initial stage, you will be having only dull aching type of pain. It is called as dull aching type. So don't neglect this one, because if you neglect this one, it will go into chronic back pain, and it will go into sciatica problem. Then you have to go for further innovation, and if needed, you have to go for surgery also. So in initial type of lower backache, when you are feeling dull aching pain, first you have to see the what is the cause. So previously what I have discussed, the cause, it might be one of the cause. So you should eliminate that cause. Means for sitting posture, you have to see the ergonomics at your workplace, and for any heavy weights what you are lifting and all those things, you have to avoid that. And in initial type of the backache, the best medical treatment is physio. Don't forget, it is a physio, and it is a back strengthening exercises followed by some muscle relaxants. So next point is, there are some physiotherapeutic methods like cold compression therapies, and followed by IFTs, and followed by infrared therapies, and followed by ultrasonic therapies. In case of you are having severe spasms, lower backache spasms, or you are having severe dull ache type of pain. So in that, the physiotherapy will help you, followed by some muscle relaxation, followed by some stretching exercise. So if this initial type of back pain you have neglected, and you have came with a sciatica, or if you are having chronic back pain, and if you are, because of the chronic backache, you are not able to walk, or you are not able to do routine your daily works, then you have to be investigated like x-rays, MRIs, and all those things. Because if your physiotherapy method fails also, you have to go for further investigations like x-ray, MRI, and your whole body checkup. Means we have to see your vitamin D levels, and your calcium levels, and your nutritional vitamin B12 and all those things, and followed by thyroid, sugar, and almost we have to check your body status, and we have to correct all those things, and then we have to do x-ray. In x-ray, you can see the your bony levels, see how much bone you are having, and all those things, whether you are having severe osteoporosis, and all those things we have to check it. So depending upon that. So next, here in lower backache, we have calcified classified into high risk groups. So who are high risk groups? First is obesity. Don't forget, your weight is your main problem for lower backache, and it is a one of the enemy for you. Don't forget, obesity is a enemy for you. So for all, many patients will be seeing obesity is one of the major cause for this thing. And next, higher risk group also includes smoking and alcohol. So chain smokers will be seeing the spinal health issues, pain smokers, more than 10 cigarettes per day. Even 5 cigarettes per day is also very dangerous for men. And so alcohol is also everyday boozing and all those things also very dangerous for them. They are in high risk groups, and followed by occupations. Generally, we will be seeing mostly software people, and followed by some drivers who are doing long journeys and who are long drives and all those things. We'll be seeing in drivers and all those things, and heavy lifting guys like laborers and all those things we'll be seeing. And next one is who is not having proper body. This thing means exercise and all those things also. And we'll be seeing in long sitting posture, means almost working for 10 hours in sitting postures also. And one is another is genetic problem. It is called as family history problem. That is a genetic problem. These are the main risks. So we have included these groups under the high risk. So previously I have said how to prevent this lower backache. See, main is your lifestyle problem. Nowadays, many people are coming with lifestyle problem only. So if you can control your weight, if you can control your habits and regular exercise, regular means per day minimum half an hour or weekly 4 times, you have to spend your time in exercise, minimum half an hour or weekly 3 times. This will improve your body health, and your back strengthening exercise and all those things will help you strengthen your back exercise. And to avoid heavy lifts, so you can lift the weights, but there is a method that you can search in Google and all those things, how you can lift your weight to prevent your spinal problems, that you can check it. Next is treatment options. So I have told, if you are having dull aching type of pain, it is a starting type of pain. So it is a beginning of disease. So here, by consulting your neuro, this thing, so one use of muscle relaxants followed by your nutritional status and just a small physiotherapy, you can prevent your back things. Next, followed by, if this treatment fail, and if you are in surgical, if we have investigated and there is a significant risk and all those things. So many patients will be seeing, they are coming with MRI from outside, because our is a tertiary care center, means our is a so many people almost they have treated outside and they will come for second opinion with us. So many people have seen many physicians, and then for 50% or 40% compressions they are giving surgical option. So from my personal request, for 30% 40% surgical option is not for you, it is not good for the patient also. So for 30 40 50%, according to my protocol, I will not give surgical option. First, we'll try by muscle relaxants, followed by physiotherapy. If it fails, it is called as neural foraminal block or epidural block. So in this, very small dose of steroid with mixture of vitamin C, with mixture of local anesthesia, it is called as cocktail regimen, will inject into your nerve which is getting irritated by the compression. So only for 30 to 40%, this neural foraminal block will help you a lot. So you can escape from the surgery by giving this neural foraminal block. So this is the one of the treatment. And next treatment is surgical. So in surgical, generally there are many surgical methods. There are open methods, microscopic methods. It is called as keyhole surgeries, microscopic or endoscopic procedures. So depending upon the patient who are fit for surgery, we'll give this option. So once again, I am warning you all people. So for 30 to 40% or 50%, please don't go for surgery. We can try by conservative methods. If conservative medical methods will fail, only we'll give surgical option for you. So the importance of timely treatment is very important. So I have told you, for any dull aching pain or starting stage of the your backache, only you can relieve it by simple medications, by exercise and lifestyle modification. For chronic conditions and red flag signs, I have told you almost 3 to 4 red flags. Definitely you have to go for surgery. So in previous eras, many people after surgery, they are bedridden. But nowadays, because of increasing technology and increasing in understanding the problem and increasing the and improvement in your surgical techniques and all this, there are a lot of improvement in your advancement or technology advancement in your spinal surgeries and all those things. So first point, be clear. So for lower backache, first main treatment is rest. and surgery is always required for all chronic or severe pains with red flag signs. And and in previous year, I have told you many failure rates we have seen in lower back, but now because of introduction of all keyhole surgeries or minimally invasive, first of all, understanding the disease and all, we are giving better results for you, and we can guarantee you how much percentage you will improve after surgery. So, so, so I'm telling. So, for if you are having severe low backache, so your working capacity will be decreased, followed by your any activities, social activities like trekking or going any picnics with family is restricted. So, and it affects because of severe pain also, your sleep will be affected, because of which, because of lack of sleep and all those things, you are prone for hypertension and diabetes and all those things. And because of lower backache, you will reduce your all work and you will become more obese. So this is a vicious circle. So vicious circle means, because of severe backache, you will restrict yourself. Because of restriction of all work, you will become obese. And because of lack of sleep, because of pain and all those things, you are prone for diabetes and all those things. So this is called as ergonomics at your workplace. So previously I have told you the ergonomics at workplace. So this is the posture that you have to. The chair also very important. See, in your office where you are working, the chair, the pattern, how it is very important for you. For example, you see first figure, how is sitting. And in second and third figure, this is the wrong method. So your angulation while sitting, your knee and leg angulation will be in this manner. And you have to have a back support at your back, and at neck also you should. So generally I prefer a long chair instead of this chair. So you are seeing here also you should have neck support. So generally you prefer a long chair at your workplace. So benefits of early prevention means, so I'm telling physiotherapy and all the things. If you're having red flag signs, don't unnecessarily delay. You consult your neurosurgeon and go for any surgical procedures that have been opted by your neurosurgeon. So lifestyle tips to manage a back pain. So I've told you lifestyle modification, exercise, and good ergonomics at your workplace, and a healthy weight. So obesity is one of the dangerous for you. You have to maintain your, so lifestyle problems and diet also. You should see that you are taking more of proteins and limitation of your carbohydrates and fatty foods and all those. So daily, I have told you, daily for half an hour, you have to do your exercise, back strength exercise and all thing. So in back exercise, there are many exercises that will be shown by your physiotherapist. So in that exercise, almost 10 back strengthening exercises are there. In that, you can select only three or four back strengthening exercises that is suitable for you, like cat cow and hamstring stretch exercise, quadriceps strengthening exercise and all those things. And next point, so your mattress also is important for you. So check your mattress whether there are any bumps or lumps in your mattress, and you have to. So my personal request is, don't use foam beds. I have seen many patients who are using foam beds. They are coming with backaches. So, so right treatment, I have told you, if physiotherapy or conservative management fails, then you have to go for surgery. Or if you are having red flag signs, then you have to go for surgeries and all this.
And now we invite you to ask your questions. You can share your queries in Hindi, English, or local language. Dr. Kiran will provide clear, helpful answers to address your concerns. Please go ahead.
Hello, doctor.
Yeah, hi.
Hi. Actually, I just wanted to discuss about my father.
Yeah.
10 years back, he had a brain attack.
Yeah, okay, right.
So now he
It
recovered
means
from
brain
that.
attack means brain stroke.
Brain stroke, right?
Yeah, okay.
Brain stroke. Now he recovered after 6 months.
Okay.
He's good now.
Hmm.
But the problem is that after he had a COVID in 2020.
Okay.
After even that, he recovered and he came back to home.
Hmm.
Now he's fit and all, but now what the complaint is, he complains about some sensation below the back pain.
Hmm. Hmm.
Below the low level sensation, some sensation he
Lower
feels.
limbs, lower
And
limbs.
lower, yes, lower part
Yeah, yeah,
from the low back, low back.
low back. See, first point, in any paralysis patient or what we'll call as brain stroke patients, there will be some transmission delay from the brain because that part has been affected, infected, or that part has been glyosed. Glyosed means there will be a scar in the brain because of your brain stroke. So there will be some transmission problems from your brain to your lower limbs because of, see, many patients we have seen in stroke patients, after 1 year, 2 years, or 3 years, still they will be complaining of stiffness in the lower limbs. That is
Yes.
stiffness. It is called as spasticity or tone. Tone has been increased in your lower limbs. That is purely from the brain. So this is the most common in post-paralytic patients or post-severe patients, that are the patients who are suffering from the brain strokes and all those things. In that, simple, first we have to examine the patient. In examination, whether it is the signals are really coming from the brain or the nerves which are coming from the spine. So there are two differentiation we have to see, whether it is from brain or whether it is the spine. If it is from the brain, just we have to wait and we have to give supportive therapy. That's all. If it is from the spine, then we have to evaluate which nerve is pressing and which group of muscles are involved, and all those things we have to see. So I will tell you, first you go to good physiotherapist who are senior most, because senior physiotherapists who are well experienced physiotherapists, they can clearly tell you whether your lower limb problem is from brain or spine. If spine, which group of muscles are involved or which nerve is involved. So better you go for one physiotherapist, or you can consult us, neurologist. Any neurologist or neurosurgeons you can consult, and then you will get the problem. That is not a big issue.
Okay, but he's having one medicine called Palmiges.
Yeah, Palmiges. It is a muscle relaxant, painkiller.
It's a painkiller.
Yeah, it's a painkiller.
So should he continue with this medicine?
No. See, first point, your father is having a lower backache, stiffness, or difficulty in walking, or pain, and those things. First, you evaluate whether it is from brain or spine.
Okay.
Because
So what is the test? Sorry?
Examination. Only examination.
Examination क्या करना है? What is the examination should he carry?
No. That is done by physiotherapist or neuro. You don't know that examination.
Okay.
Yeah.
Okay. He need to go through any test. Will you advise any test?
No. See, for after examination only, if it is a brain problem, we'll go for brain test. If it is spine problem, then we'll go for spinal MRI.
Oh, so first I have to find out whether it is from brain or spine.
Spine, yeah, that's correct.
Okay. Okay, doctor. Thank you so much.
Yeah.
So, sir, I have a question. How do you differentiate the pain which is related to stenosis, and how do you differentiate it from that which is related to a prolapsed disc?
Yeah. See, this is a very good question. See, in stenosis, you can see the claudication pain. See, what is claudication means? If you walk for half meter or 1 kilometer, you will get severe burning sensation in your lower limbs, and followed by tightness in the lower limbs. And after that, you have to sit for almost for 2 to 3 minutes. Then you have to start your walk. This is called as claudication pain. Claudication pain means, so if you are walking above for half meter, if it is a severe stenosis patient, you are not able to walk even for half meter. That is a severe stenosis. You can see in severe stenosis patient. But after 1 kilometer, half kilometer, you are getting claudication pain, that your stenosis is at moderate, mild, moderate, severe. In severe stenosis, only for half meter you will get claudication pain. In moderate stenosis, you can walk for half kilometer, then you will get the claudication pain. In mild stenosis, for almost 2 to 3 kilometers, you will get that claudication pain. So in stenosis, you will get a typical feature is claudication. And next, in what you were telling, prolapsed disc with root compression, you will see the patient will be clearly complaining of lower backache with right radiculopathy. Means there will be a sciatica. There is a, what I have previously told you, there will be a change in the character of the pain. Means your lower backache pain has been radiating to your right limb. This is a typical of cause for the disc protrusion and compression over the nerve root. So sciatica in the prolapsed disc, and in degenerative degenerative spine, you will be seeing claudication pain.
So, sir, you mean that stenosis will not have any radiation or radiculopathy?
No. See, in beginning of this thing, claudication means you will be having radiating pain, but before that you will be having stiffness in your lower limbs, followed by, after a while, means you will walk almost for half kilometer and half meter, you will get cramps in the lower limbs, both lower limbs.
Okay.
Yeah.
Okay, sir. Thank you.
సార్ గుడ్ ఆఫ్టర్నూన్ సార్.
యా, గుడ్.
సార్ నాకు యాక్చువల్గా ఏంటంటే, సార్ తెలుగునా?
తెలుగు చెప్పండి.
సార్ లాస్ట్ ఇయర్ యాక్చువల్గా ఏంటంటే ఇలాగే నాకు లోయర్ బ్యాక్ పెయిన్ వచ్చేది లాంగ్ సిట్టింగ్ ఉన్నప్పుడు, ట్రావెలింగ్ చేస్తున్నప్పుడు, మార్కెటింగ్ ఫీల్డ్.
ఓకే.
అయితే ఎప్పుడైతే వస్తూ కొద్దిగా రోజు వాకింగ్ చేసుకుంటే కొద్దిగా క్యూర్ అయిపోయింది. మళ్ళీ ఏంటంటే ఇటు విజయవాడకు వచ్చాక మళ్ళీ మనం కంటిన్యూ ట్రావెలింగ్ అయిన తర్వాత మళ్ళీ రైట్ లెగ్ లెఫ్ట్ లెగ్ సమ్ టైమ్స్ అటు ఇటు వచ్చినప్పుడు వాకింగ్ గట్రా ఎక్సర్సైజ్ చేసేసుకుంటే మనకి ఆ రేడియేటింగ్ పెయిన్ ఉండేది తగ్గిపోయేది. అయితే రీసెంట్గా ఏమైందంటే ఆల్ ఆఫ్ సడన్ గా లోయర్ బ్యాక్ పెయిన్ తో పాటు లెఫ్ట్ ది సమ్ టైమ్ లెఫ్ట్ సమ్ టైమ్ రైట్ రేడియేటింగ్ పెయిన్ ఎక్కువ వచ్చేది. ఎక్కువ వస్తే ఆల్రెడీ ఇంత ముందు వచ్చేది కదా అని మన ఫిజియోథెరపీ ఈ సయాటిగా అనుకుని ఆ ఎక్సర్సైజ్ చేసా. అయితే ఫస్ట్ December 12th ఎంఆర్ఐ తీపిచ్చేసారు. తీపిచ్చినప్పుడు మనకి అందులో ఏంటంటే రైట్ స్పాండిలోసిస్ L5S1 డిస్క్ బల్జ్ అయింది విత్ పోస్టీరియర్ యాన్యులర్ టియర్ అని మెన్షన్ చేశారు ఎంఆర్ఐలో. తర్వాత ఇందులో కూడా అంటే నర్వ్ ప్రెస్ అవుతుంది కూడా మెన్షన్ చేశారు. తర్వాత మళ్ళీ January 17th ఇంకో 17th వచ్చేసి ఇంకొక ఎంఆర్ఐ తీపిచ్చేసారు. అందులో ఏంటంటే బిఫోర్ ఫెస్టివల్ కి సర్వైకల్ పార్ట్ అంతా బాగా పెయిన్ వచ్చేసేది. ఈ ఎంఆర్ఐలో కూడా డిస్క్ బల్జ్ C3 కానీ C5 బల్జ్ అని చెప్పారు. అయితే ఇందులో కూడా ఏంటంటే డిస్క్ బల్జ్ విత్ పారాసెంట్రల్ టియర్ అని మెన్షన్ చేశారు అట్ L5 అండ్ S1 లో. ఇప్పుడు నేను అంటే ఒక హాస్పిటల్కి వెళ్ళా సార్. ఇక్కడ వెళ్తే ఏంటంటే మనకి ఇది కీ హోల్ మైక్రోస్కోపీ ఆపరేషన్స్ అనేది సజెషన్ చేశారు. యాక్చువల్ మీరు చెప్పినట్టు ఏంటంటే మా ఫాదర్ వచ్చేసి అప్పుడే వెళ్ళొద్దు అని అంటున్నారు. అయితే ఇప్పుడు ఏంటంటే ప్రాబ్లం ఏంటంటే నేను ఆల్మోస్ట్ December 17th కానించి టిల్ డేట్ వరకు ఆల్మోస్ట్ 90% రెస్ట్ లో ఉన్నా. జస్ట్ 1 or 2 days మహా అయితే ట్రావెలింగ్ చేసి ఉంటాను అంతే సార్. అంటిల్ అన్లెస్ రిక్వైర్మెంట్ బట్టి అంతే. మిగతాదంతా బెడ్ రెస్టే. ఈవినింగ్ మార్నింగ్ వాకింగ్ వెళ్తున్నా సార్. ఆల్మోస్ట్ 7 to 15 kilometers వరకు స్లో వాక్ వెళ్తున్నా. అట్లనే అట్ ద సేమ్ టైం వెయిట్ లాస్ కూడా అయ్యా. బట్ ఇప్పుడు మేజర్ ప్రాబ్లమ్ సింటమ్ అంటే ఏవైతే ఇంతకుముందు బల్జెస్ ఉన్న ప్రాబ్లమ్స్ ఇప్పుడు ఓన్లీ కూర్చుంటేనే నరువు లాగుతుంది. అది కూడా ఏంటంటే సర్వైకల్ పార్ట్ కంటే మనకి కరెక్ట్ గా చేతులు వెనకాల పాయింట్స్ ఉంటాయి కదా సార్, దాని కింద పెయిన్ వస్తుంది.
సో ఫస్ట్ పాయింట్ ఏంటంటే మీకు లోవర్ బ్యాక్ ఏక్ వల్ల నెక్ మజిల్స్ కూడా స్పాజమ్ లో వెళ్తుందండి.
ఓకే సార్.
లోవర్ బ్యాక్ ఏక్ యాక్చువల్లీ డిస్క్ బల్జెస్ ఎవరికైనా కామన్ అండి. వేర్ అండ్ టేర్ లైఫ్ లోపల డిస్క్ బల్జెస్ ఆర్ కామన్. జస్ట్ ఎంఆర్ఐ లోపల బల్జ్ కంటే ప్రొట్రూజన్ అండ్ ఎక్స్ట్రూజన్స్ ఉండద్దు. ఎక్స్ట్రూజన్స్ అండ్ మైగ్రేషన్స్ ఉండద్దు డిస్క్.
ఓకే సార్.
బల్జెస్ గురించి మీరు ఎప్పుడు కావాలి. సో ఫస్ట్ పాయింట్, ఇప్పుడు మీరు చెప్పిన హిస్టరీ ప్రకారము మీకు లోవర్ బ్యాక్ ఏక్ వచ్చి బ్యాక్ మజిల్స్ వీక్ అయ్యి తర్వాత మీకు రేడియేషన్ అవుతుంది కదండి, ఇంటర్మీడియట్ రేడియేషన్.
అవును సార్.
ఇంటర్మీడియట్ రేడియేషన్ మీకు లోవర్ బ్యాక్ ఏక్ మజిల్స్ వీక్ అయ్యి నెక్స్ట్ డిస్క్ మీద పడి యాన్యులర్ టేర్ అయ్యి అక్కడ నుంచి మీకు ఏమైందంటే మధ్యలో నవ్ ఇరిటేషన్ అవుతుంది, కంప్రెషన్ కాదు కానీ ఇరిటేషన్.
ఓకే.
ఇరిటేషన్ ఉండడం వల్ల మీకు ఇంటర్మిటెంట్ సయాటికా వస్తుంది, కంటిన్యూస్ సయాటికా ఉండట్లేదు.
ఓకే.
అంటే అప్పుడప్పుడు కాళ్ళకి లాగడం అవుతుంది మీకు.
యెస్. అయితే ఇప్పుడు కంటిన్యూ తగ్గింది సార్. బిఫోర్
తగ్గింది.
ఫెస్టివల్ కానించి తగ్గింది.
అదే.
ఇప్పుడేంటంటే మీరు కూర్చుంటేనే ఈ ఓన్లీ నరం లాగుతుంది. అది కూడా అంటే సర్వైకల్ పార్ట్ కానించి
మీరు బ్యాక్
విపరీతమైన
ఎక్సర్సైజ్
పెయిన్
ఏమేమి
వచ్చేస్తుంది.
చేశారండి? బ్యాక్ ఎక్సర్సైజ్ ఏమేమి చేశారు?
సార్ బ్యాక్ ఎక్సర్సైజ్ మీరు చెప్పింది క్యాట్ అండ్ కౌ చేస్తున్నా సార్.
ఉమ్.
తర్వాత
కాదు, మీకు
మీరు
ఫిజియోథెరపిస్ట్ మీ గ్రూప్ ఆఫ్ మజిల్స్ ఏమేమి ఇన్వాల్వ్ అయినాయి, ఏవే వీక్ ఉన్నాయి చెప్పారా మీకు?
ఫిజియోథెరపీలు అంటే వాళ్ళు మనం చెప్పే కదా సార్, కార్పొరేట్ హాస్పిటల్‌కి వెళ్ళినప్పుడు వాళ్ళు ఫిజియోథెరపీ కొన్ని ఎక్సర్సైజ్‌లు చెప్పారు సార్. బట్ డాక్టర్ సజెషన్ ఏంటంటే మీది బోన్ టీర్ అయింది. ఏవైతే మనకి ఎక్స్‌రే తీసినప్పుడు అన్నీ కూడా ముక్కు కింద ఉంటది కదా సార్. వెనక ఉండే స్ట్రెయిట్‌గా ఉండే బోన్ కనెక్టివిటీలో
అవును, అవును.
అది కొద్దిగా లాంగ్ డిస్టెన్స్‌లో ఉంది. దానికి రాడ్స్ స్క్రూస్ వేయాలని చెప్పారు.
లేదు లేదు, మీరు ఇప్పుడు ఎక్కడ ఉన్నారండి? నారాయణ గారు?
విజయవాడ సార్.
విజయవాడ. ఒక్కసారి సో మీరు ఏం చేయండి అంటే ఒక్కసారి నాకు మీ ఎంఆర్ఐస్ అని నాకు గ్రూప్ ఫార్వర్డ్ చేయండి.
ఓకే సార్.
తర్వాత
సార్ నెంబర్ ఏమైనా ఉంటుందా?
నెంబర్ ఇస్తారు.
పెన్
ఆ?
సార్ పెన్.
ఇక్కడ ఈజీ ట్రీట్మెంట్ ది వీళ్ళు నా నెంబర్ ఇస్తారు, నాకు ఫోన్ చేయి, మీరు కాంటాక్ట్ కండి.
ఇప్పుడు అంటే ఇప్పుడు తర్వాత అప్రోచ్ అవుతాక మన నెంబర్ ఎలా ఉంది సార్ అదే?
ఇప్పుడు ఈజీ ట్రీట్మెంట్ మీరు వీళ్ళకి చెప్తే వీళ్ళు నా నెంబర్ ఇస్తారు. నా
మీ
దానికి
పేరు
వాట్సాప్
మీ పేరు సార్?
నా పేరు డాక్టర్ కిరణ్, న్యూరో సర్జన్ అండి. గూగుల్లో సెర్చ్ చేసిన వస్తుంది, కేఎస్ కిరణ్ న్యూరో సర్జన్.
ఎక్కడ సార్ మీరు?
నేను
హైదరాబాద్?
యశోద హాస్పిటల్ సికింద్రాబాద్ అండి.
ఓకే. ఓకే సార్.
సో మీరు నాకు ఒక్కసారి ఎంఆర్ఐ చూడాలి. స్క్రూస్ చెప్పారు, ఇవన్నీ చెప్పారంటే ఏమైనా స్పాండిలైటిస్ ఉందా అని చెప్పి చూడాలి.
ఓకే సార్.
స్పాండిలిస్థిసిస్ అంటాము, లిస్థిసిస్ ఏమైనా ఉందా చెప్పాలి. అంటే బయట ప్రాబ్లం ఏంటంటే ఈవెన్ 30-40% కూడా సర్జన్ చేసేస్తామంటారు.
ఓకే సార్.
సో బిఫోర్ దట్ మీరు ఒక్కసారి నాకు ఏం చేయండి అంటే ఎంఆర్ఐలు ఇవన్నీ పంపియండి, అన్ని పంపించిన తర్వాత నేను చూస్తాను.
ఓకే సార్. తర్వాత మీ గూగుల్‌లో దొరుకుతుంది కదా సార్ మీ మెయిల్
గూగుల్లో
ఐడి?
అయిపోతే ఈజీ ట్రీట్మెంట్ వీళ్ళకి కూడా అప్రోచ్ కండి, నాకు చెప్పేస్తారు. లేదా గూగుల్ వెళ్ళి డాక్టర్ కేఎస్ కిరణ్ న్యూరో సర్జన్ అని కొడితే వచ్చేస్తుంది.
షూర్ సార్. షేర్ చేస్తాం సార్. థ్యాంక్ యూ సార్.
Sir, so I have one more question. So the people come up with telling ki walking will improve the back pain. It will help to reduce the symptoms. So how long can the walking be suggested for a patient with back pain?
I tell you now, half an hour means 3 kilometers.
At a stretch, sir? Should they be doing at a
Initially
stretch?
when you are starting this all exercise and all those things, so we'll suggest only 1 kilometer walking, 1.5 initial.
Okay.
So after 10 days you can increase day by day to half kilometer. So if you are not having any busy schedule, or if you are not having any this thing, you can spend minimum 1 hour in your walking or back exercise.
Okay, sir.
No, if you are having if you are a working woman, or if you are a housewife woman and all those things, 30 minutes per day is enough. In 30 minutes you can cover 3 kilometers.
Okay, sir.
Or per week 3 to 4 days.
Okay.
Yeah.
Thank you, sir.
Anyone wants to ask any more questions with the doctor?
Good afternoon, sir. This is Mr. Mukesh from Hyderabad.
Yeah.
First of all, I'd like to thank you for the lecture, sir. It was truly enlightening.
Yeah, thank you.
I'm just seeking your advice on a personal health matter, which I'm experiencing the
Yeah.
backache and the right leg pain following a bus journey recently, sir.
Okay.
I consulted an orthopedic surgeon about 15 days ago, and he prescribed some medications, including like gabapentin, something like that, sir.
Right.
So while the medication provided some relief to me, the temporary relief, the
Okay.
pain gets when I'm stopping stop taking the pills. So could you please offer some guidance on how long I should wait? Because the doctor told me.
No. See, first point, After examination the patient, we can come to a conclusion whether it is a muscular problem, means paramuscle, means in your back there will be muscles now, whether it is a
Yes,
muscle
sir.
problem, whether it is a ligament problem. In between the spine there is a interspinous ligament will be there. Spinous ligament problem, or it is a nerve problem, or it is a bone problem. So after examination, what orthopedician has told you?
Sir told us some L3, L4 in between that some nerve is getting pressed.
Yeah. So
Okay,
I think you are having only, previously I have told you now 30 to 40% compression will offer only conservative management or medical management for them. So it is called as irritation of the nerve. So for irritation of the nerve, most probably by doing good physiotherapy and good posture, and for 1 month is enough for treatment for you, medications.
Thank you so much, sir. Thank
So
you.
first 10 days to 15 days, we'll give gabapentin NT, next muscle relaxants, followed by physiotherapy. After 10 days, we'll decrease the dose, and we'll re-examine. So we'll re-examine and we'll see how much improvement you have got, and depending upon that one, mostly by 1 month, I think it is enough.
Thank you, sir. Thank you so much.
Yes.
సార్ ఒక చిన్న డౌట్ సార్.
చెప్పండి.
ఇప్పుడు ఈ గాబాపెంటిన్ గాని, పెరాగ్లిమ్ గాని మనం సుమారు ఎన్ని రోజులు వాడొచ్చు సార్?
వాడచ్చండి. దీస్ ఆర్ ఆల్ వెరీ సేఫ్ టాబ్లెట్స్. గాబాపిన్
Okay.
అనేది, ప్రిగాబిలిన్ అనేది మేము కొంతమంది సర్జరీ డయాబెటిక్ న్యూరోపతీస్ ఉంటాయి కదండి, డయాబెటిస్ వల్ల నరాలను చచ్చుబడి ఉంటాయి కదండి,
అవును సార్.
వాళ్ళకి 3-4 ఇయర్స్ కూడా వాడిపిస్తాం. సేఫ్ టాబ్లెట్ అండి, ఏం కాదు. యూ కెన్ యూజ్ ఇట్.
యాక్చువల్‌గా నేను అంటే మీ దగ్గర షేర్ చేయలేదు సార్ ఇది. నేను ఈ పెయిన్ కోసం ఆల్మోస్ట్ ఆల్ ఇప్పుడు ఒక 40,000-50,000 స్పెండ్ చేసి 7 హాస్పిటల్స్ వరకు తిరిగా సార్. అలా ఈవెన్ కైరోప్రాక్టిస్ కూడా చేపించా. అలాగే వెయిట్ లాస్ అవ్వాలన్నారని చెప్పి నేను 104 నుంచి ఆల్మోస్ట్ ఆల్ 91 వరకు లూజ్ అయ్యాను సార్. అయినా సరే ఏ అన్నది ఎక్కడ కూడా
కాదండి, ఒకవేళ మీది నిజంగా సర్జికల్ కేసు ఉంటే నీకు ఏ మెడిసిన్స్ హెల్ప్ చేయవండి మీకు.
అవునా సార్? ఇప్పుడు
మీది నిజంగా సర్జికల్ ఇండికేషన్ ఉంటే మాత్రము ఇవన్నీ వేస్ట్ ఆఫ్ టైం మీరు.
సార్ ఒకవేళ మనం ఇప్పుడు ఒకవేళ ఒకవేళ సర్జరీ అయి ఉంటే సార్, మనం ఒకవేళ కీ హోల్ సర్జరీ లాంటి కేసెస్ కి వెళ్తే ఫ్యూచర్ లో మనం కూర్చుంటాకైనా ఏమైనా ట్రావెల్
అన్ని బాగుంది.
చేస్తాం.
నేను ముందే చెప్పాను కదా, ఇప్పుడు టెక్నాలజీ అడ్వాన్స్మెంట్ అయింది, అన్ని అయినాయి. ఇంత ముందు బ్యాక్ సర్జరీస్ చేసుకుంటే ఫెయిల్యూర్ రేట్స్ ఎక్కువ ఉండే. ఇప్పుడు టెక్నాలజీ అడ్వాన్స్మెంట్ అయ్యి అన్ని మంచిగా అయిన తర్వాత ఏం లేదండి, రిజల్ట్స్ ఆర్ వెరీ గుడ్. అంటే మేము కేస్ స్టడీ చేసి అన్ని చేసి దాని ప్రకారం మేము చెప్పగలుగుతాం, ఎవరికి ఎంత రిజల్ట్ ఇవ్వగలుగుతామని ఓపెన్ గా చెప్పగలుగుతాం.
ఓకే.
యా, రైట్.
ఓకే సార్.
Any more queries? Okay then.
Yeah.
Thank you, doctor, for your time and patience. It was really
Hello.
productive
Excuse me.
session.
Hello.
You want to ask a question?
Yes.
Yeah, please go ahead.
Hello, sir.
Yeah, hello.
Due to continuous 8 to 10 hours sitting, I am facing that back issue continuously from the past 1 month, and from the 1 week, it is somewhat heavy. That means from the school level itself, there is a burden of bag and all.
Your age is
27.
27. You are a software.
Sir?
You are working as?
No, I am in preparation for government job.
Oh, so right. How many hours you are sitting daily?
Around 8 hours.
Yeah. That is the main cause for you. So for every half an hour, you change your positions. That is enough for you. Yeah. And next followed by, you are doing any back exercise?
Yes, I will do yoga.
Yeah, you are doing no particular back exercise, not yoga, back exercise.
Back exercise matlab bending.
Bending means there are some back exercises that you can check in YouTube and all those things. Back exercise for back strengthening muscles.
Okay.
Back strengthening exercise. So you do that one, and next followed by you check your vitamin D and B12 status.
B12, yes, I am going to check it.
Yeah. D also. D and B12 are important for you.
Yes, yes. And
That
next
is
day I could not bend completely. In the earlier I could bend up to, I can touch my feet, but now it is somewhat nearby.
Yeah. Once you do your master health body checkup, so that is important for you. Master health body checkup followed by back exercise. That is enough for you.
Okay, sir.
Yeah. Right.
So, as a special offer for attendees, as a token of our appreciation for joining today's webinar, we are excited to offer free screening, 30% off on treatment costs. To claim the offer, feel free to call our WhatsApp number at that's 900-000-1766. Our team is here to assist you and guide you forward towards health. Conclusion. Thank you for attending today's webinar. We hope you found this session informative and valuable. At Easy Treatment Health Private Limited, we are committed to supporting you on your healthcare journey. Please reach out to us for any assistance and don't forget to take advantage of our special offer. Have a wonderful day, and we are looking forward to seeing you at our upcoming webinars. Take care. Bye-bye.